Yeah.
Looks great.
Okay, awesome. And also, yeah, thank you for having me and creating this space. It sounds like it's right, everything that I've been looking forward to in a safe space, being myself being neurodivergent, queer, non-monogamous, all of the things. So I'm just really happy. I'm excited to talk to all of you. I'm also hoping that maybe it can be interactive because I don't want to hear myself talk for the whole time. So I might be asking questions here and there if anyone feels comfortable answering. That would be awesome. If not, we can also wait till it's not being recorded. I'm happy to question and answer time at the end too. But questions are always welcome throughout. I also want to say I am not a doctor, so I don't handle the medical side of ketamine assisted therapy. I do specifically the psychotherapy portion of things. There are some things in here that I do know, from the research and around working with a medical team. I work with Journey Clinical and they handle all of that for me. Thank goodness. So I have some information in here, but it's just the basics. And if there's very specific medical questions, I might have to just say I don't know the answer. Yeah. And so first, just diving in a little bit about who I am. I graduated with my master's in social work 12 years ago now, just wild, time flies. And in that time, I've worked with lots of different groups of people. Um, my first, I'd say 7 years of practice were actually in community mental health settings, worked with children and families, involved with the CPS system. My first couple of years working, like 80 hours a week, all of that. It was really tough. I provided intensive family preservation services. And after a couple of years of doing that, just kind of realized that I was burning out fast and wanted to work with adults. And so that was all in Miami, Florida. Decided at that point, May 2015, to move to Seattle. And then I started working at DESC, the Crisis Solution Center. I became a clinical supervisor. I really loved that work for, clients experiencing all different types of crises, most commonly mental health or substance use related. After maybe a year and 9 months, I was promoted to a different part of the agency where I ran some programs around people experiencing homelessness with basically the most severe and persistent mental illness, things like psychotic disorder, schizophrenia. And it was a really cool program. I loved it. It was outreach and, bringing, actually doing mental health evaluations on the street, working with the most vulnerable people, basically people that no one else wanted to work with. And I loved my team. I loved my clients. The long story short is I got burnt out by the bureaucracy of, community mental health and social services. So after 7 years of doing that, I thought I would never honestly go into private practice. I was like, I am forever going to be about, social justice and working with the most vulnerable and marginalized people. And I didn't, for a long time, I had my own biases around how we can still make a difference in private practice. And so really kind of worked through that. And then in, say, 2019, transitioned to private practice, joined someone else's group practice at first. Then as we know, COVID hit 2020. And I was like, okay, everything's virtual. I might as well launch my own private practice. And then now mostly who I work with are people who are queer, non-monogamous, or neurodivergent, or as I don't know if you have the same experience, but that Venn diagram, there's a lot of overlap. So often at least two or even all three of those identities. And that's who I really love to work with. Obviously, a big part of that is because I myself also share these identities, and it's I really like to give back to my own communities. Um, and then in terms of psychedelic assisted therapy, I don't know if there's a way to see or not. I kind of want to know, has anyone had experience receiving or, involved with ketamine assisted therapy specifically or psychedelic assisted therapy? I don't know if there's like a raise hand function. Yeah. I see one, I think, but I can't see the whole grid. So I'm not sure if there's more than one person, but I think one person that maybe has some experience with it. Okay, awesome. So for me, it started psychedelics, started with my own personal journey with it. And just realizing how powerful it is and has been with the things that I've gone through. And I didn't even realize that that was something that we could do as therapists. And so then I learned about that, decided to go to get some training around it. And so I went to Integrative Psychiatry Institute, and it's a year-long program that covers MDMA assisted therapy through the MAPS program, psilocybin assisted therapy, and ketamine assisted therapy. And it was a really great program, very intensive, a lot of work, but I learned a lot and I love that. And so then since that time, the only one that is legal right now in Washington is ketamine. So I offer ketamine assisted therapy. Though I will say that probably the other two are they're like more exciting for me, but I do really also love offering ketamine assisted therapy specifically for my populations. Um, any questions so far about any of that before I actually dive into the good stuff? Oh wait, it's not letting me. Oh wait, there we go. Okay. So again, being neurodivergent, I think I always like to know what to expect going into a presentation. So here's some of the main things that I plan to talk about. My flavor of neurodivergent is I also try to pack a lot of things in, so I'm hoping I can get to all of these things. But if not, then I also put the information, the most important parts on the slide. So hopefully we can maybe send this out to people so they can, anytime they want to access this information, they can feel free to look at what I created. Perfect. Okay, so I'm gonna drink some water. So first up, what even is ketamine assisted therapy? So you can see here it's legal, it's safe, and it's an effective treatment for mental health conditions such as depression, anxiety, and PTSD. Those are the most common ones, especially for treatment-resistant depression and people with like chronic suicidality. It's really known to be very effective for. But there is emerging research around other, mental health things such as OCD, eating disorders, sleep disorders, borderline personality disorder, bipolar disorder, specifically around the depressive episodes, and substance use disorders. And I'm probably missing some, but there is also research around other things as well. But probably the big three that you'll most often see are around depression, anxiety, or PTSD. It's very rapid, the antidepressant and mood enhancing effects. The other big thing that I like to talk about is around neuroplasticity. And so that's, I like to give the analogy to my clients, for example, that, our brains, right? Maybe you've heard this, and I've heard other therapeutic modalities use this analogy as well. But imagining that our brains are like when we're born, right? This fresh layer of snow. And then as we do things, we have, specific behaviors, habits, thought patterns, etc. It's like you're going on a sled down the hill of snow. And the more we continue to go down that same path over and over and over again, it's like we have these deeply rooted thought patterns, etc., behaviors that happen. And it's really hard to like lift that sled up, move it to another one, and actively try to create a new path, right? But what ketamine assisted therapy does is it kind of just gives you a fresh layer of snow. And now it's like, okay, it's so much easier when we have this fresh layer to look around and say, what intentionally do I want to create now? And so there are several different ways to administer ketamine assisted therapy. I have some basic info about all of them, but the only one that I use is the sublingual lozenge form. That's also because I also do all of my services virtually, and so that's the thing that also works best for me. And I'm happy I have a slide later to talk about what my approach is. So I know there's some questions about how do you do this virtually, so I'll dive into that as well. Okay, so next up. And then also, if I can't see if there's anybody, I only can see a few of you. So if there's questions or anything, maybe the moderators who can help me, just let me know that there's a question or something, so I only can see you too. So some of the things that make it different than some of the typical, I guess, medications and therapeutic approaches for dealing with like depression, anxiety, and PTSD, that's all listed here. I don't know if I want to actually like read through it, but maybe I'll just take a second. You can kind of see it's fast acting. It's known to have anti-suicidal properties. Some clients even say after the first session. For example, one of my, clients was one of the most depressed people that I've met, and really struggled with that a lot. And we worked together doing talk therapy for years and years. And though I will say we made some progress, of course, it was hard to really break through. But then doing, I think it was 6 dosing sessions of ketamine assisted therapy throughout the whole program, being able to, even something as simple as like seeing her cry for the first time with me was like wild, right? And then being able to just like was not feeling suicidal anymore. And then that created also some opportunity to work on some other things, right? When that's not so present, we were able to then dive into some other therapeutic things that were going on. Very few side effects. The ones that I've seen, for example, are like sometimes some clients have some nausea. That does happen. For me, again, I'm going to go into my approach later, but I even send in the mail a welcome kit, and one of those things includes like ginger mints. Also because the ketamine doesn't taste super good, and like, pretty much 100% of people that have done it are like, this tastes really bad. So as soon as they're done with that part, I give them the ginger mints, both for the potential nausea and also to not have to have that taste in their mouth anymore. It's high response rate, and it's really especially, again, good for people who have already tried several different other approaches to deal with, their depression and have found this will work for them. Any questions about this? This is kind of like the science stuff, and then I'm going to get into the more interesting things. History, a very brief history of ketamine assisted therapy. You can see here some of the interesting things is it also is used in both human and veterinary medicine. When I'm talking about the way that we do ketamine assisted therapy, it is considered off-label. Um, some kind of facts here about how it was first synthesized. And kind of the thing I also talked about and what the, it's again good for depression, anxiety, PTSD, especially, but some of those other ones they're also studying now. Okay, I'm gonna move on. History was never my strength, so. Okay, so here are the routes of administration, and I kind of just wanted to go over some of the basic pros and cons of each approach and when it might be best used for. So you can see here, again, I only do the oral administration, that third one. And I actually myself as a client, I have received ketamine assisted therapy with the intramuscular administration also. So I have experience from the client side doing that one. Um, I don't know if you want me to, maybe if you have any questions about any of these styles, and then I'm going to dive deeper into the sublingual form. I think the other thing too to mention with all of them is what I'm talking about is ketamine assisted therapy. And so it's really an assistant to the therapy is really important. So some places, I have had, for example, I have another client who goes to an IV clinic to get ketamine assisted, just a ketamine infusion, right? And the way it goes is they just, plug you into the machine. And not all of them, but a lot of them are like they plug you into the machine and they leave you there. And you kind of, you deal with whatever comes up. For me, that's not my style at all, and not how I really believe in how it's a benefit to the therapy. So that's kind of what I'm focusing on today. Just even from my own personal experience and what has come up in psychedelic experiences and ketamine specifically, I can't imagine being just like left alone in a room, especially in like a sterile environment, and like that would be really hard with all of the things that comes up. And so that's why I also really believe in the therapy piece of things. One, to like, that's a big part of what I do is holding space for my, my clients as they go through whatever might come up in a psychedelic journey. And also so they don't feel alone, and then also to guide them through, again, whether it's a challenging experience or, ask some questions about what they're experiencing, or just sometimes I just sit there and stare at them for an hour while they're under, the influence of ketamine. So those are the four main routes of administration. This kind of goes into what I was just talking about, why it's crucial. Um, Even thinking through, it's like, I think, yes, here's all of the data and the facts, but I know what actually tends to stick more are like hearing stories about things. And obviously I can't go super into the stories of what my clients have all experienced. So then thinking about, stories from my own experiences with psychedelics and just imagining what it would have been like without, therapeutic support, whether it was, going through a messy divorce in my own life and going to an ayahuasca ceremony and having, support, integration support after that. That was hugely beneficial for me and helped me, I guess, make the insights I was gaining in my experience really like concrete and how I can actually apply that into my life. So I think, yeah, the therapy is super important. As I mean, most of you are, I think, are therapists. I think you probably get that and why. Okay. So then my approach specifically is, again, I'm, neurospicy and I like to be super prepared for things. And my clients often also fall into that category and want to know, like, what are we about to experience together? How is this going to work? And so, again, my program is entirely virtual. I work with individuals. I also do relationship ketamine assisted therapy. I do small groups, up to 4 people max. And then also I can go into like therapist-led versus self-led dosing sessions, because one of my values too is accessibility for my community. So I'm trying to find different like price points that different people can be able to access this, because it's hugely transformative. The way it works is I offer 2 to 4 preparation sessions before we even dive into the dosing, right? Well, even before that, we have to do a consultation, make sure that they're a good fit for ketamine assisted therapy. Then I refer them over to the medical team at Journey Clinical. They do a whole screening with them, all of the medical side that I don't want to handle and I'm not qualified to handle, make sure that they're good to go. They send them their ketamine prescription in the mail. And then also I have an access, we both have access to the shared treatment plan, so we can work together, very collaborative, which is super important to me. And then once they're approved, then we start at least 2 preparation sessions. I prefer 4 just because there tends to be a lot of questions that come up for people. I also have, again, a very intense, so I have a 100-page workbook that I have created. And I just finished my really queer version. It's just, and I'm going to also work on in the future of like one specifically for non-monogamous people, one specifically for neurodivergent people, that I'm really like working on specific workbooks. And then I also have a very general one for people who don't fall into that category. And we just go over everything from how to prepare, what to expect during dosing, how do you actually take the ketamine, how do you do your blood pressure, so you do have to take your blood pressure before actually doing the dosing session. Also, since I'm not there in person, everyone is required to have a chaperone, an adult chaperone. That is somebody. So I go over like, what are the good, like, how do you know someone could be a good chaperone? How do you know someone might not be a good fit to be your chaperone? And then I also have how to set boundaries. One of the big ones, for example, is around touch. Touch can be hugely beneficial in these therapeutic experiences. And it also can be really harmful because it's depending on what kind of touch it is. And so ahead of time, before any ketamine is on board, we talk about in depth what kind of boundaries do you envision wanting to have around touch with your chaperone. And we literally spell it out, and I have almost like it's not a legal contract, but a little contract that we make with between the client and their chaperone of these are the touches that I think might feel good. Maybe I want you to hold my hand if I ask for it. Maybe I might want a hug. These are the touches that I absolutely do not want, or I don't want any touch whatsoever, or I don't want you in the room with me. It has to be someone in the house. So if there is an emergency, knock on wood, there hasn't been one for me, then I have somebody who can call and respond to them. And so anyways, I have this workbook, we go through it. That way they feel really extra prepared. And then we move into having a dosing session. So clients can either choose right away if they want to have a self-led dosing session. That means we've done even extra preparation on what to expect. And this usually is more for people, ideally, if they've had some sort of psychedelic experiences before, and know what might come up for them, or even better if they've had ketamine assisted therapy too. But anybody can opt to do the self-led dosing sessions. And I basically check in ahead of time at the beginning and at the end, and that way they don't have to pay for my full 3 hours with them because that can be expensive. Or we can do sometimes, even if someone wants to do ultimately self-led sessions, we can also do first having a therapist-led session where I am there virtually with them for the whole 3 hours, and then moving into when they feel ready doing self-led sessions or back and forth. My favorite is obviously I like to be there and to be a part of their experience. Some of the benefits of those ones, I think, for example, when someone is, I mean, kind of how it works, right? We have, if I'm there for the session, we have a beginning, let's check in. How has the last week been? Is there anything that's heavily on your mind? We usually then talk about the intentions that we've already been discussing that you have for this specific dosing session. Then we like to do some sort of ceremony. It really is different depending on the client, but a common one that I do is, okay, let's get out a piece of paper. I also send them a journal in the mail. And so like you can use your journal if you want. And what do you want to release from this space before we dive in and do this dosing session, right? Is there anything that's really heavy on your mind? Maybe you talked to your mom and she was really judgmental about ketamine therapy and that's really sticking with you. Or maybe you had a hard conversation with your boss, whatever it is, right? What do you want to release so it's not part of this experience? And they actually write it down. And then like cross it out, scribble it out. Sometimes they even burn it safely, of course. And then after that, we do, okay, well, now what do we want to welcome to this space? And that's things like connection to myself, insights, clarity, understanding. It can be lots of different things, right? What do we welcome? And we write it all out. And then we either, again, burn it or circle it and just like whatever it is to like take a moment to welcome that into the space. Then I have a whole dosing day checklist, making sure you have all of your items nearby. I really like also one of the benefits of doing it this way is that clients can be in their home, which has, some people really prefer to go to an office setting. And I think there's different things for different people. But one thing I have learned is that like having their own stuffies nearby, their favorite pillows, even sometimes their animals. Like I have my 2 dogs with me right now, and it's really great when I have them there for psychedelic experiences, if they're not going to cause a distraction, of course. So I really like also that piece of things. And then, we go through the list, you have everything ready, we take a little bathroom break, and then we come back and then they start, the dosing. So they take their ketamine. So, for 12 minutes, basically they have it there. They put on their eye shades that I also send them. They put on their music. I'm going to dive into music in a second and why that's really important. So they have their playlist, they put it on. We just double check that they can hear me also while they have their music on, because that's really important. And then it's kind of usually, most often, pretty quiet for about an hour. And I just usually do like a check-in and we talk ahead of time. How often would you like me to check in? Okay, we're at the 10-minute mark. Okay, we're at the 30-minute mark. We're at the hour mark. I guess the other big thing to mention is after those 12 minutes, they spit out the ketamine. So they need to have something nearby to spit that out. And all of the saliva and things going on in their mouth, they spit all of that out, take their ginger mint, and then we kind of start the process. Sometimes clients are more active and want to like, they just might just say things, blurt things out. Like I just saw this thing happen, or they feel a lot of feelings, right? They might be crying and I'm just, there if they need, but most often I'm pretty quiet during that portion. And then when they start to come out of the effects is usually around 45 minutes to an hour, maybe sometimes a little bit shorter, a little bit longer, depending on the person. Then we start doing the beginning of integration. And one benefit I think also of having me there is if it's cool with the clients, which it usually is, I kind of type up what they're saying and then send it to them after. So that way they have a kind of a record of what they experienced. And so that's kind of how a typical dosing session goes. Usually the integration time is 30 minutes to an hour at the end. And then we talk about kind of what their plan is for the rest of the day. It's really important to rest, not go to work after you have a dosing session. Definitely don't drive. Probably not doing any like really strenuous physical activity is really about resting. And then I have an integration session I usually do it so far 100% of the time within the next day, within 24 hours, but during a clinical does require it within 72 hours. And that's where we really kind of talk about all of the insights and really dive deeper into what they experience in that dosing session. So that's kind of how I do it. I'm probably missing some things, but that's kind of the basics. Any questions about that before I move on? I don't see any. Okay. Here's some of the ketamine myths. I'll let you take a look at it for a second while I hydrate. So some of the big things that I hear, one is a silver bullet. It's going to fix everything. All of my problems are going to go away. That's not what happens. Again, it's like an assistant to the therapy, but like the ongoing therapeutic work and support and integration are all super necessary. And I'll dive deeper into integration in a second. Also that it's going to fix everything right away. That doesn't always happen, right? Sometimes it takes, like people do usually, I would say, see benefits within the first session, but often after that 6 to 8 dosing sessions is where we really start to see the biggest impact. And then the other big thing that I see is that like it all depends on me as a therapist, that I'm the one that is healing them. And when really that's not the case, I see my role as helping. I believe we have our own inner healer, our own, guidance and what we need. And I'm really there to help support them in finding out what their inner healer is saying and what they feel that they need. I'm not here to be like, no, you see, clearly you need to leave that toxic relationship. No, it's like helping them get in touch, bring those protectors down, right? From an IFS perspective, bring those down so they can actually kind of see more clearly what's happening. So again, this kind of gets into some of the medical side of things, but here's some of the most common rule outs that you can see. First one, if someone has like a heavy history of substance use disorders, especially if is there someone with a question? I think I see a hand up, maybe.
Yes, hello. So it sounds like you are more like you like I love all the things you're saying, but it sounds like what I'm hearing is that it's more of a short term type of like you don't work with clients long term. Is that correct?
For this, I mean, usually I would love to work with clients long term, but it doesn't have to be. Kind of, I guess, is unique depending on the situation. But my favorite is actually when I've had some of my long term, psychotherapy clients that are like, I think I'm ready to try ketamine assisted therapy now, and then we do
Yeah.
the deeper dive. It's been most beneficial because then we have this ongoing relationship and trust that really I think helps. So it kind of gets rid of that stuff. But then also it can be an add-on if somebody else already has a therapist, and I would love to bring that person in and collaborate with them also. And then it can be short term. So it kind of depends on what the client needs.
I see, because I was thinking that I was like, this is such an awesome opportunity for like long-term clients, because then they finally can overcome a certain hump. And if I'm there to witness it, like we could do the work, I could see how the work there's so much growth and how the work continues. But I could see how if this is a short-term type of therapy where you do a couple of sessions here and there and then it's over, well, you could lose the foundation.
Yeah, I definitely agree. And also I've heard this saying that it's like doing a ketamine therapy dosing session is like putting 3 months of therapy into 3 hours. And it does
Sure.
sometimes feel like that. So it's like, and then we do that over 6 to 8 times. I would definitely think that there needs to be some sort of support in place. I'm always happy to work with people ongoing, but at least like then connecting with their other, their therapist or other support systems to continue that work. Because it's not just like integration is one of the biggest pieces of this, I guess.
So you say most of your clients then are your current psychotherapy clients that are now having this opportunity because you're trained in it.
Yes,
And
that's the vast majority for sure. Yeah. And
interesting.
it's a
Okay, so
different experience, like when I just meet someone and then we're just like, we need to have, that's why it's a minimum of 2 preparation sessions, but I usually like to do a few
yeah,
more to at least get to know somebody. Um,
but
but I
people
also,
don't reach out to you just for this.
they do as well. Yeah.
They do as well. Because
Yeah.
like I mean, as an IFS person, like people reach out and be like, I want IFS, and they'll reach out for me for that, and that's what we're doing. And I was just kind of curious if people reach out and say, I want ketamine therapy, and like you are only going to see them. Like it sounds like there's a difference between if they already have a therapist or if they just want it and they don't have a therapist yet. Because if they don't have a therapist yet, you're likely probably to convince them this could be a long-term thing.
Yeah. Yeah. So it's kind of a what feels best for you and your specific needs, and we can kind of go from there. But yeah, people do reach out just for ketamine assisted therapy. They already have a therapist, or they just want to just try this out for 6 to 8 sessions, right? But then I do always encourage, like, you need to have some sort of support in place. Let's talk about what are your support systems. If that's not going to be me, do you have another therapist? Do you want me to help you find a therapist? Especially if I'm like, so also like speaking to the fees and things. I do currently take insurances, a few of them. So I think I take Regents, United, First Choice Health, Kaiser, Optum. I don't know if that's the same as one of them. I have someone that handles all of my billing and things, so that's not my strength. But for right now, only the preparation and integration sessions can be billed to insurance, and the dosing sessions cannot be. And so sometimes for financial reasons too, they need to, if they're not in network, then it's like I'm open to like the unique person that is in front of me and what they need, I guess is the
Yeah.
long story short.
Oh, thank you so much for sharing all of this with us. It's so fun to learn from you.
Yeah, of course. Good question. Um, yeah, so you can kind of see here, going back to some of the common rule outs. Again, we're going to send these slides, so this is kind of the boring part, so we can look at more of that later. Um, Now these are kind of the things that I really love talking about, like how, like what is really important to consider when we're doing this, right? So the big two things I would say are set and setting. Set refers to the mindsets that people have coming into a session. Ketamine is known in a lot of psychedelics as a non-specific amplifier. So I talk about that with clients all the time. Like whatever you have going on in your mindset, heading into a dosing session is probably just going to be amplified, right? So if you are super stressed, super anxious, that could be like, that can amplify that, right? Versus like we do a lot of work. That's why I prefer 4 preparation sessions. And I send mindfulness resources. I send other things to start working on having a positive mindset, one that's open, one that's ready for whatever's going to come. So yeah, mindset, super important. And then also setting is also really important because that's gonna, if you're in a, let's say a chaotic environment or there's, dishes right next to you, and then you're in the middle of your ketamine experience and you're like, oh, forgot I have to do the dishes. Oh, and I need to clean this room. Oh, and I forgot my stuffed animal. That's my favorite, right? It's just gonna totally distract from your experience, or even worse if there's worse things that can happen with setting. And so yeah, I really like, again, like why having people in their own homes tends to be, not all the time, but tends to be a safe, comfortable place for them where they have all of those items nearby. So yeah, set and setting, super important. The other thing I'd love to talk about is how important music is I believe in psychedelic journeys in general. It's been really, if you haven't tried it before, it's super impactful having a good playlist to support you throughout your journey. I will say I've had some clients who have opted not to listen to music, which was, I think, I would say it didn't feel like it went as deep as it can. So the music, and also there's, I have a podcast episode. I can't remember if I put it in here as a resource at the end for y'all, but if I didn't, then I can send it. About how it's almost like the other therapist in the room. It like can lead you, like different tempos, different experiences can lead you along the journey that you can have. And so I talk a lot about music in the preparation sessions. And then if you want to, well, I guess I'll get to that in a second, the next slide. So here's a little bit about what kind of music is really important. It's Some people would like to have, I don't know about you, but I have like my favorite songs that anytime they come on, they make me happy. I can sing with, I can dance with. That's not the type of music that we want for a ketamine dosing experience, because that's gonna, if I'm thinking about Lady Gaga in the middle of my dosing, that's not gonna be helpful, right? Instead, it's more like instrumental music without lyrics, usually like songs that I'm not super familiar with. Slow to moderate pace is usually pretty good, something soothing and calming. Some people prefer nature sounds. And then this next slide I also give to all my clients, and it's a whole bunch of example playlists that can be beneficial for psychedelic journeys. And one of my favorite activities, I have lots of favorites, but one of them is ahead of time I have them listen to these, or also other playlists. These ones I think are all on Spotify. And then they create their own dosing day playlist of 15 to 25 songs, depending on their length, picking kind of from a variety of these, which ones really speak to you. And then also actually tailors nicely into one of my favorite integration activities, which I'll talk more about integration in a second, is now they've had their dosing, they listen to their playlist. Let's say it's a week or two later, they can actually listen to their same playlist they used during their dosing session while they're not under the influence, and like be journaling or on a nature walk. And usually like some extra insights come about because it's like reminding you with the music of what you experienced during that dosing session. So Music is really important. There's a whole podcast episode about it, not by me, someone else. And then also, if you want to also listen to these, I think hope all the links will work when I send this, but you can feel free to listen to them, pick your own playlist if you want. Whether that's if you're going to start your own ketamine assisted therapy experience for yourself, or if you want to, if you're doing, I don't know, other psychedelic journeys, these can be great for that as well. And now I've talked about integration a few times. This is like one of the biggest, most important parts of the, ketamine therapy. And that's like okay, you have this dosing session, it's really powerful. I saw all of these things, I had all of these insights, but then how do we actually put this into practice in life, right? So some of the activities that I recommend, depending again on the unique person that someone is. Some people really hate journaling, so of course I'm not going to recommend journaling if that's not what you want to be doing, but I do have some good prompts that help for that. Just spending time in nature, sitting and quiet listening to nature sounds, that's something that's really calming for a lot of people. Meditating, just quiet reflection. There's also some somatic experiences. Personally, after a psychedelic experience, I like to, not in the day of, but usually in the next day, I like to have a massage. I don't know why, but I have some of my most powerful insights in that massage the day after a psychedelic journey. And so that's something that I really enjoy, not for everybody. And then also another big one that I like to do is like doing something artsy. And I'll say I'm not like a talented artist. I think anybody can be, an artist and create things. And so I also talk with clients, even who that might not be the thing they're most familiar with, about like art can take any form. And I actually go through, I think I have like 10 different ways you can try art, whether that's doodling, it can be coloring, it can be taking photographs, it can be painting, it can be doing sculptures, whatever it is, but doing something, like creating something. And I even have I've had clients who in that integration time at the end of a dosing session, instead of like talking with me, which is also, it's totally the client gets to lead, right? You don't have to talk to me if you don't want to. And that really just like to draw what they experienced. For me, that hasn't, like, I'm not one that's drawing immediately after my experience. Usually it's usually in the days following, but some people right after, like and it's the way that really is most impactful for them. So integration is super important. And then also, again, here are some of the other things to think about. It's not a one size fits all process. There's not one thing that I've done that is going to work for everybody else. It's about really knowing and listening to what you need, your own inner healing intelligence. What do you need to integrate what you just experienced? Timing is also, again, everything varies. Everything is unique based on the person. But typically, in the day following and really the first 30 days after a dosing session are the most impactful to like really be integrating those insights that you had. That's also because of the increased neuroplasticity. I had another client that realized, they had been trying to learn another language for a long time and were really hitting some roadblocks. And then they noticed that when we started doing ketamine assisted therapy, which this is not why we started it, but all of a sudden they just shot through their Duolingo and were learning it so much faster than they ever have. And it's like, yeah, neuroplasticity, it's a real thing, even for things unrelated to what I think we're going in for. It's great. So and it's not just like I'm going to integrate today and it's the only time I'm going to integrate, I'm going to journal and then now I'm done. I've done my integration. No, it's like honestly, it's a lifelong thing. I'm still integrating psychedelic journeys from years ago, having insights. So it's like ongoing process. It's also touching on, I think was it Britt who we were talking earlier, like that's really having that support in place for after, because it can be ongoing for the rest of our lives, integrating what came up for us. Okay, so now diving into some fun stuff. So first up, some of the benefits I'm going to dive into for queer people specifically, for non-monogamous specific people specifically, and also neurodivergent people, because those are, the groups that I tend to work with the most. I mean, one of the reasons it's really beneficial for queer humans is the rates of, like we said, depression, anxiety, substance use disorders. They tend to be markedly higher in the LGBTQI plus population than others. And, that's, I think related to all the discrimination that we experience living in a world that is, was not created for us, and the constant, I guess, challenges that we face just existing as a queer person in this world, right? And so ketamine therapy can help alleviate some of that. If you have questions about that, this is just kind of why I think it's, really important. Me being a queer human, I've seen it myself too. I think the biggest way to explain for all of those groups of people is that it helps a lot of people realize who our authentic selves are and to live that and to be able to unmask and to just be more step fully into, for example, our queer power. Like, this is who I am, and yeah, society maybe doesn't like this aspect of my identity, but this is who I am and I'm proud of it, and I'm going to authentically lean into that and find the safe spaces for me where I can do that, right? And so that's one of the biggest benefits I would say that I see is like it's like why am I, it's like the society boxes that we're put in. It's like we all of a sudden see them through these experiences. Like, why am I trying to fit myself and mold myself to be what this other, person or what the society wants me to be? Instead, I'm going to be who I actually am. So, okay. So other things too, for example, not sure, but religious trauma can be a thing that impacts a lot of us queer folks. I know I'm still recovering from some religious trauma that I experienced. And that's one of my favorite things to do to work through with especially queer clients, but all clients. And it really helps to like, for example, I had a client who that was one of their biggest intentions was to dive into the religious trauma that they experienced and how that was still continuing to shape how they live their life now, even though they're, as an outwardly authentic queer person, but it was still they found holding themselves back, right? And being able to lean into and like, this is who I am, and this is how it impacted me. And it didn't just impact my gender identity and sexual orientation, but also even just sexuality in general, and being able to unpack some of that and then intentionally choose how do we want to move forward from those moments. So, um, yeah, that's kind of a very quick intro into how it helps or how it can help queer humans. And then for non-monogamous humans, has anybody here read the book Queering Psychedelics by chance? It's I think I have it at the end, like a little picture of it. I don't have it with me right now, but it's like a whole bunch of different authors that all compiled into one book, all under, Queering Psychedelics. And so there was one in there by Justin Natalie. I don't know if I'm pronouncing their name correctly. But they kind of talked about how there's three main challenges that psychedelics can help non-monogamous humans deal with. The first one is dealing with shame. And that's a lot around, as we probably, if anyone else wants to self-identify, but there can be a lot of shame coming up in that. For example, I am polyamorous, and my parents are very religious and did not like, in their words, the lifestyle that I've chosen, right? And so dealing with the constant like shame from close family members or society in general, there's so much, cis heteronormative conditioning, but also monogamous conditioning that this is the pathway to live a happy life. You need to, meet someone, fall in love, move in together, get married, have a baby, have your white picket fence, have, all of these steps, and that's the secret when actually that's like maybe the secret for some people, for sure. That's a valid lifestyle for some people, but also, what I really like is like we all have our own unique paths. And so this helps figure out like what is your unique path, right? And dealing with the shame other people have put on us through that. So that's kind of about dealing with shame. And the next one that Justin Natalie talks about is navigating past trauma. That comes up again for people of all different identities and things, the traumas that we've, experienced. And so this can help us look at it in a safer way. I've really enjoyed working with my clients who have PTSD, for example. And again, going back to the IFS perspective, it really does is like brings down some of these protectors, and you can feel safe from a more, because it is a dissociative as well. So it lets you with some distance be able to look at the things, the really hard things and the challenges that we've experienced. And then to start doing that healing work while under that influence. It also sometimes it can unearth memories that we forgot, even for in my own life. In one of my psychedelic journeys, I relived what it was like from age 2 to 11, and I don't have a lot of memories in my conscious life of that time period, and I actually got to relive it. I felt it in my body, did a lot of inner child reparenting. I remember the biggest thing was like holding my young Sarah, and we just sobbed together. That was a really tough psychedelic experience. We just sobbed almost the whole time, and then we did puke, me and my inner child. But even that felt really like good, purging out the trauma of what it was like to feel so unloved, right? And so yeah, I was able to actually process that and then move forward after that experience. And it's really helpful for a lot of the clients that I've seen to navigate the traumas that they've experienced. Um, what else? The third one that Justin Natalie talks about is transcending labels. It's again about like all of the boxes that society tries to put us in, and instead figuring out, I think labels, for example, can be really helpful for a lot of people if it's like labels that we are choosing for ourselves to help explain who we are to somebody, for example, but also they can be really constraining for some of us, or when other people put labels on us, etc. And so really like psychedelics help us look and almost just see all of these boxes that we're in and why are we in them, where did they come from, and then start to heal that and then intentionally choose maybe if we want to put ourselves in a specific box or multiple boxes and kind of choose that path forward. Um, also I have also worked with non-monogamous people in their ketamine assisted therapy sessions. And one that really sticks out to me is um, in his, ketamine session, it started coming up what he felt, from his attachment figure, his parents growing up, and then realizing that those patterns, again, all during that 1 hour session, how those patterns were still manifesting themselves in various ways in current romantic relationships, and then able to choose, like, how do I actually want to relate to people and be able to, like, learn, again, with that neuroplasticity too, being able to learn healthy relationship skills and what does this actually look like. But it was like being able to see that whole process was really powerful. Any questions about how it helps queer people or non-monogamous people before I dive into neurodivergent humans? And I have no idea if I'm still on time. I don't know how much time I'm supposed to have for this. Yeah, how am I doing?
You're doing great. Just take all the time you need. This is really lovely.
Okay, awesome. Okay, so for neurodivergent humans, and I have ADHD, for example, and I can talk about the benefits that I've seen with various psychedelics and their experiences on my own self, but also hear some of the things. There is like emerging research around this, and there is some people that feel really strongly that it doesn't help, and some people that feel really strongly that it does really help. So then I do have at the end, I have some resources where you can see some of the different sides of things. Some of the biggest things that I've noticed, let's see, what do I have actually written here? A lot of the things that will help anybody, but being able to venture into difficult emotional territory is really helpful. But other things too is like, because it's so known to help with anxiety, most often, not all the time, but a lot of neurodivergent people might have some co-occurring things going on, like anxiety or depression or substance use disorders or PTSD from dealing with having to live in a neurotypical world, right? And so some of these things, it can bring those things down, and then you can receive a lot of benefit even just from that. I've also heard one of my neurodivergent clients shared that what it really helped them with around their neurodivergence was feeling like they had more capacity to deal with when life's, and like hard things that would happen, whether that was having a flat tire that historically might have sent them into a meltdown, and then being able to like, oh, now since I've started my ketamine dosing, I was able to handle it and I felt more grounded. And yeah, it still sucked because sometimes life is shitty, but that they were able to now have the capacity to deal with that. And that's one of the biggest things I've also noticed for myself, is just feeling like I have more capacity to deal with things. It also helps me personally. It has helped me to be able to, how do I say that? I have this wonderful ability to hyper focus on things, that I'm really passionate about, and it's helped me almost like harness that in the right moments. And then to like be able to have more capacity to turn that off when it's not the right moment to hyper focus on something. So that's something that I've noticed again also for myself. I think the biggest thing too is that I talk about with my clients is like unmasking, right? And like being able to, and something I'm still doing in my own life, is trying to create a life that actually I can be my most authentic neurodivergent self, and surrounding myself with people who are safe and supportive and understand the uniqueness of who I am and how that manifests in our relationships and in our lives, right? And so we're talking a lot about being able to find those spaces where you can be yourself, right? And actually, like, it's not a problem with us. It's, actually that the world was created for neurotypical people, and being able to like, it's really a lot about like accepting, right? Accepting who we are, and actually that there's a lot of strengths that come from it. And then also it can help with some of the things that might be a little bit more challenging too. That's like the long story short. So here is some stuff specifically around ADHD. I kind of talked all about it on the other slide, so let me see if there's anything else I hadn't already said. Yeah, feeling more able to start a task that felt daunting. I've definitely seen that. Even something like opening my mail that I don't really want. I don't know if anyone else struggles with that, but like I really don't want to open my mail, and like finding that I have more capacity to do that, because I just, not knowing what to expect, what is in there, but being able to do that. The other big thing I always talk about for all of these things is really starting from a place of self-compassion. And so I found that it helps people be more compassionate towards themselves too. And here's some stuff here. I'm seeing if there's anything specifically. Oh, the other big one I would say is I've seen around like sensory experiences, even for myself, like a lot of loud noises, big crowds, harsh lighting, like specific types of touch or textures. I found I have I still, I still struggle with them for sure, but I have more capacity for maybe longer periods to be able to handle, environments like that when I need to, right? Like I can go through a crowded place when I need to more easily now, for example. It also again can really help with reducing the intensity of anxious feelings. That's a big thing. Um, and really around that acceptance that I already talked about. Oh, I think there's a question here.
Yeah. I was just wondering if how often folks have like pushback in their systems. So I could totally see like when you're explaining all this, I'm like, yeah, all this makes so much sense. Like when you can work with yourself in those deep, meaningful ways that can heal executive functioning, that can heal certain things. But I can imagine that as an IFS therapist, it takes me so long to like oftentimes get permission from people's protectors to get to those places that I wonder how much ketamine bypasses some of those things where there could be pushback in the system afterwards, where like maybe not right away, but maybe sometimes where there's a protector will come up, maybe a one that eats a lot or something where
Hmm.
it's you bypassed me by doing this thing and now I'm pushing back more.
Yeah, no, that's a great question. And I also IFS pairs super well with ketamine assisted therapy. By
Yeah.
the way, if you wanted to do, I don't know if you already offer that ketamine
I'm
assisted therapy.
I'm very aware of IFS and its connection to psychedelics.
Yeah.
Yeah.
And so like that's also why I really like to have preparation sessions ideally for because I talk right up and I have some workbook activities specifically around parts work and how they might come up in ketamine assisted therapy and we deep dive into it and start to get to know those parts ahead of a dosing session is my ideal situation.
Sure.
And then like how to handle when there is pushback, how to handle, and I do talk about that is something that does happen sometimes, is
Mhm.
after following a dosing session, is some of those protector parts are like, like you said, like I mean, there's so many different protectors that we can have, but there is sometimes that happening, and that's also why I like to have that integration session the day following, and to really be available in case there's some big protectors, that come up that
Well,
need.
yeah.
Yeah.
That makes so much sense. And especially since it goes back to our earlier conversation of you just make sure that they have ongoing therapy support. That's the best opportunity.
Yes,
Thank
definitely.
you.
I think there's another question from CJ.
Yeah. I just wanted to add to that point too. Having worked with neurodivergent humans and ketamine, like one reason that sometimes I think IV can be a better or like can maybe be more suited for some folks who have really strong protectors is that you can like stop an IV session and obviously like the ketamine will still be in the system, but it's easier to like cut the experience short essentially. And I've had specifically neurodivergent humans who like get really overwhelmed with new experiences or like have these really big protectors around like staying in control of their body that will do IV and will start by like doing like 5 or 10 minutes of IV rather than the full 45 minutes to an hour. So just naming that like that's also maybe an option for folks who um like have really strong protectors that they're working with and like want to try it, but need to be able to maybe like, yeah, modulate that middle ground.
I love that. That's a great point. And it makes me think too, one of the things that I like around the sublingual form and the way that I do it with Journey Clinical is kind of similar in that the first session, we start with, they actually send 3 tablets, right? And so the requirement is the first session, they start with just one of those. And then after that 12 minutes, they can decide, spit it out. We wait until 15-minute mark. How are we feeling? Then if they're like, okay, I'm ready, I want to dive deeper, they can take that second tablet or even the second and the third tablet to have a deeper experience. So it's kind of like a slow start to introduce them to like, and I've had people want to start at super low doses just to experience what it's like. But I can imagine how much even more beneficial it could be to actually be able to just like turn the IV off and like, okay, we're gonna end this experience faster. Which is not, you're right, that's not something that I can do with the sublingual form. Um, okay, so what else do I have here? I kind of touched on it already. I'm jumping all over. But yeah, really the biggest thing is being able to help with some of those co-occurring disorders can be super beneficial. Also to help with how it impacts the neurodivergence. I don't know if I don't think there's anything else here that I haven't already said. So moving forward, I also think it's great, right? This is maybe also for each of you, right? Working with clients in any type of therapy, I think this is important, who has that, I think that lived experience and shares those identities is can be really impactful. And I'm not saying that you can't work with someone who you don't have that lived experience of. Of course, I'm not saying that. But even for myself, I've found it really beneficial to be working with, for example, someone who is queer and non-monogamous in my own therapeutic journeys. That way there's that already that understanding. And so I think it's even just with how vulnerable clients can be in a psychedelic experience, having someone who, you know, has a baseline understanding, lived experience of being queer, being non-monogamous, or being neurodivergent, I think is really impactful. And I think that's honestly, that's my opinion. Also for other therapy in general too, just how impactful that can be. And then just a little quick info about the group that I have coming up that who was Marie, I think you mentioned it earlier at the beginning. So it's basically it's a 6-week group coming up in January only for queer folks. It's maximum 4 people who can join. This is a quick program schedule. You can also go to my website. I think I actually changed websites, which is a long story, just recently in the last 2 weeks. So I think the old website was sent to the email, but the new one is courageousoutherapy.com. And you can find out more information about that. Currently, I see people in Washington and Idaho, and I've applied for Florida as well, just given the state of the world. I feel like they might need some more queer therapists there. And so if that comes through too, then I could take clients from Washington, Idaho, and Florida, hopefully in the future. And then there's a lot more on my website about it, but that's just kind of the brief what that is coming up. Then this, again, I'm going to send it, has a whole bunch of like podcast episodes, you know, articles, research studies, books, things that if you want to now hyper focus on this like I have, you can feel free to click on all of those links. So we can make sure maybe someone can send that out to the group after if you want to check out more. This is the book in the bottom right corner I was talking about, Queering Psychedelics, by the way. It's really great. I go back to it regularly. And then any questions? That's all I got for today. I'm sure I forgot some things, but that's all I got right now.
So I want to encourage everybody to ask questions, knowing that like we are recording, but the questions that you ask will help others as they watch this later. And then we will turn off the recording so you can ask questions with some more privacy. There's a question in the chat. Any advice for supporting clients with religious trauma around psychedelic journeys, since the symbolism can mirror traditions of faith traditions that cause the harm, especially for queers?
Wait, I'm gonna just look at the chat really fast and my brain works like that. Where was that one? Or maybe could you reread it again? I see a lot happening in the chat. So maybe could you reread
It
that?
says, any advice for supporting clients with religious trauma around psychedelic journeys, since the symbolism can mirror traditions of faith traditions that have caused harm, especially for queers?
Yeah. I think one of the things I like to talk about with my clients, even around ritual and ceremony, and especially if we're going to be diving into religious trauma concepts as part of their intentions, is like what would feel really good for them, right? And like really identifying what kind of practices would feel good, what kind of, you know, or having comfort items nearby around that help them support them through those moments. And then also like if I ask about, is there anything specifically that I can do to support you if these things come up, whether that's around religious trauma or other things that are going to be overwhelming in some way. I'm not sure if that gets to exactly what the question was, but I like to like kind of talk to the client about and how to come up with a, I guess, approach together for how to handle that.
And then if you could just again say the name of the institute that you did your long learning with,
Yeah.
and just once again state other states that you can currently work in outside of Washington.
Yeah, it's Integrative Psychiatry Institute, IPI is the place that I studied. And so it was a really great program overall. It was also the thing that I liked about it, it was all virtual except for the experiential that happens at some point. I had mine at the end where you actually go and you do a ketamine session for one of the other therapists in the cohort. So you lead a session as a therapist, you also receive as a client, and then the third one as you witness another therapist and a client, right? So that was a really powerful experience. But the rest of it was all virtual, which just really worked out great for my life. And then I can currently see people. I'm based out of Washington. I also just got certified for Idaho, and then I'm working on Florida. As of now, who knows what the future holds, but can I see another question here from Robin?
Hi. Yeah. So one question I have relates to ketamine treatments and weight. So I also know a lot of people who have a lot of trauma around weight and medical stuff. So is A, is the medical side of things that you work with, are they weight informed? And how does that work with adjusting dosage? Do they do any like disqualifying people based on BMI? Do you have experience working people with weight related trauma?
Yeah, great questions. Part of that I don't know all the answers to because again, I don't handle the medical side, but I do know that weight is one factor of many that they consider in the dosage. I honestly don't know exactly what their formula is for that, or if I don't know either if there's like exclusion criteria around that. Also, if you want to send me an email, I can reach out to the medical team and see and ask more. I'm happy to like ask them because I don't know the answers to that. And then yeah, I also have worked with several clients around lots of trauma around that. And a lot of it is kind of related to some of the other things that I've talked about with other identities and things around. Most of it has been around society and the messaging it has and how impactful that is, and like unpacking a lot of that, which ketamine can also help with that, and bring up memories of times that there's traumas and wounds around that. And then also like stepping into again like your full authentic self, and like so it's been a lot around that, I would say, from that lens. Does that answer your question? Did I miss one? Anything else about it?
I think that's really helpful. Thank you.
Yeah, awesome. Thank you for the question. Any other questions anybody has?
There was a question related to, especially in other states, how would you suggest that we go about finding sort of ketamine or psychedelic therapy for our ongoing clients?
Yeah, so I mean, I also am a fan of Facebook groups in some ways. So there's a psychedelic therapy Facebook group. I don't know what the criteria is to join, honestly, but I think there's some people in there that you could reach out to and search. I would also just be careful about choosing a good spot, looking at reviews, hearing their experience, hearing their story, what their approach is. I think it's really having a trained, and lots of things I could say about facilitators and how important that is. Also, maybe in like the queer therapist group is another one if you're part of the queer community. That's another one I've reached out, and there's people that are on there. And then for myself, I know like Journey Clinical, if you wanted to do the same form that I'm talking about, they have like a map of the states that they currently serve. So you can go and see, I think you can even click on the state and see the providers that serve people in those states. Otherwise, I just often sometimes just do like Google searches, ketamine assisted therapy in a specific location, and then like reaching out and kind of talking through.
Wonderful. Thank you so much. It's been so lovely to have you, Sarah Wolfer. I know that I'll be referring a lot of humans to you. And I'm going to end the recording now so that we can have some more questions with a little bit more privacy. And again, thank you so much. And we will make sure that we send out all the resources that Sarah talked about.